Hi there, this is Chris from In the Mess, and for this video we're going to talk about how to assess a patient who has fallen. Anytime you want to assess a patient, you want to start off by doing a full A to E assessment. And at this point you also want to include a blood glucose at an early stage. In each patient you want to consider cardiovascular problems. These can include arrhythmias and hypotension. You should consider neurological causes such as low blood sugar, seizures and strokes. Additional things to be considered are medications and any cause for infection. Start off by doing a top-to-toe examination, examining the head for any evidence of scalp hematoma, the neck for any C-spine tenderness, and if there is suspected head injury, examine the ear for hemotympanum. It's worthwhile assessing the mechanism of the fall and whether this is due to collapse. If you're able to get a history from the patient, it's worthwhile asking them if they've had any precipitants for a fall, such as faints, fits, or funny turns, any evidence of new weakness or any focal neurology, whether or not they have any other evidence of head injury, such as nausea and vomiting. It's worth finding out as well whether or not the patient had any loss of consciousness. You want to consider mechanical causes. These can be as simple as the patient's footwear and their surroundings within the room. For investigations, you may wish to consider imaging. For this, you might require plain film X-rays for long bone injury, and you may consider CT imaging for any considered head injuries. For patients who are able to weight bear, you should perform a lying and standing blood pressure to assess for postural drop. If there's any doubt, it's worthwhile performing an ECG. So you should also perform routine bloods. In elderly patients, urine cultures, as well as considering urinary retention, and consider a bladder scan. You should perform a medication review to identify any types of medication that can precipitate falls. These include analgesia, anticholinergic drugs, antihypertensives, and anticoagulants. The key point is to address the underlying cause for the fall. Once you've identified the cause, you should aim to treat it. This can include adapting the patient's surroundings, including bed rails, footwear, and any walking aids. After your assessments, you want to consider regular observations, including neuro observations as per your local trust. It's essential to hand over to the incoming team for any required assessment by physiotherapy or occupational therapy. Falls can happen in a vulnerable group of patients, and even with minor falls, there can be significant injury. In summary, you want to assess for any evidence of head injury, neck and spine injury, and long bone injury. As always, like and subscribe if you want to see more content.